159th from the moment we started in May 2020. This year, we will continue with the webinars, sharing, learning with the best information available and always based on evidence. As a benchmark of health in the region, we continue doing joint actions nonstop with the 6 member countries, Bolivia, Colombia, Chile, Ecuador, Peru, and Venezuela. And we fulfill the goals and objectives in order to strengthen the health of our people. Today, in a joint manner with the Executive Secretary of COMISCA, the Council of Ministers of Health of Central America, we would like to highlight some key messages for the epidemiological situation in our regions. We have the influenza, COVID, and the respiratory syncytial virus. They recommend to intensify the vaccination campaigns. And remember that the protection of the vaccines against COVID-19 is renewed with the booster shots, and that the priority age group, due to their highest vulnerability, are the it is highly important to meet and to complete the vaccination schemes. Also, you need masks, hand washing, and isolation of people who have symptoms. We need to remember also that in those areas where there is highest concentration of people, there is an increased risk of acquiring the disease. And that's why it is recommended to ventilate the spaces and to use the masks all the time, that you stay in those enclosed spaces. It is important to remember that the vaccines against COVID-19 are available for the elderly, for young people, as well as for our boys and girls. It is important to prepare them to the safe going back to school in the case of the Andean countries. Let's protect our families against COVID-19. We would like to also highlight the importance of solidarity and respect for people. So, having said this, today, Thursday, February 9th, we open our virtual doors to talk about something that is very important for our region, this webinar number 159, which is integral sexual education. And we need to leave behind taboos and myths. So we invite you all to please write down your name, organization, and the country you belong to in the chat box. It could be YouTube and Facebook also. And then you can also write down your questions or send them through the email webinar orasconu@gmail.com so that we can respond them after the event. To have access to the certificate of participation, as we already do it, you need to fill out a brief form and then leave your information so that we can issue the certificate. On the link, you will find also, the links, you will find them in the chat box also. And then the certificate will be sent in the upcoming days via email. To begin this important day, I'm going to give the floor to Dr. María del Carmen Calle Dávila, the Executive Secretary of the Andean Health Organization, Hipólito Unanue. Thank you very much, Gloria. Welcome, everybody, to this webinar organized by Orasconu and SECOMISCA about sexual education in adolescence. Prevention of teen pregnancy is a challenge for the health in the member countries of SICA and of Orasconu. Hence, it is necessary to continue working in a way that will allow the adolescents to exert their sexual and reproductive rights, exploring the causes, effects, and the mechanisms to promote, prevent, and improve sexual and reproductive health. That's why, and considering that in this period of life, there are several biological changes that occur, among them hormonal changes and the appearance of the reproductive capacity and the childbearing capacity, as well as changes in terms of cognition, emotion, and social arena. And that really presents big opportunities to build and to consolidate healthy ways of living, where we can learn and they can learn to exert their rights, but they can also assume and share responsibilities. Currently, we have the highest number of adolescents in the world, and also they deal with more information. They have access to the most amount of information of all times because they acquire that through social network and other digital media. That's why adolescents need support and they need access to timely and quality information that will allow them to make decisions that will prevent certain behaviors that could generate risks for their health. In our countries, after the COVID-19 pandemic, there's been an increase in different social issues that affect the well-being and or weaken the human rights in general, and in particular, the sexual rights of students, where we can see problems like sexual violence, sexual exploitation of girls, boys, and adolescents, homophobic bullying, or early partnership, virtual harassment, sexual harassment, and violence in the affective links. All of these warrant the need of implementing integral sexual education. As we have mentioned in other opportunities, integral sexual education is part of a complete and totally indispensable education that every human being has right to, beyond just acquiring knowledge, given that it provides competencies and skills for life. It should be understood that sexuality is part of life in its different stages or ages and in its full diversity, and that it does contribute to the development of their identity, therefore to the social development. And this is a quote by UNESCO. Integral sexual education promotes values, knowledge, attitudes, and skills. It contributes to make conscious decisions about the caring for the body, interpersonal relations, and the exercise of sexuality. In the same way, it contributes to prevent public health problems like teen pregnancies and sexually transmitted diseases, including HIV/AIDS. It should be noted that most of these problems affect women, and especially girls and female adolescents, because of the cultural norms and societal norms that reinforce inequitable and violent relations. This webinar then that deals with integral sexual education, leaving behind taboos and myths, is one activity of the many that we developed jointly with Secomisca since the cooperation agreement was signed in 2014. And it has had very important results, like the celebration of the Andean Week and the Central American Week for the prevention of teen pregnancies, and the development of 4 Andean Central American fora that were held in 2014, 2016, 2020, and 2021. And we had the participation of experts, of subject matter experts, regional authorities, and youth leaders who shared and expressed the way they felt, to how adolescents felt. I would also like to announce that the Andean Central American Forum will be held this year, hopefully in person. So before I finish my words, I would like to, I would like to say that it is of utmost importance in order to have healthy sexuality and exert human rights and sexual rights, to have the active participation of adolescents. And so I would like to tell you that this is something that I am going to bring to the World Pediatrics Conference. They asked me to talk about the active participation of adolescents in exercising their sexual and reproductive rights. And the Andean Health Organization, or ASCONU, has a lot of experience in that. But as we always say, many years ago, for people to really participate, we need three things. First, we need that they know how to participate. They need to have knowledge that is evidence-based. Secondly, they need to want to participate, because not everybody wants to participate. And then the most important thing is that they let them participate. And that means that in all of these fora, definitely everything that is mentioned, it has to be applied and taken where several adolescents shared, and all of these was shared with the ministers of health of the countries. So I do believe it is important that everything that the adolescents say should also be taken to the most important authorities, so that we can try to have a legal framework or something that is more supportive for sexual education. So thank you very much to all our panel members. It is really a pleasure to be here. Thank you for accepting being here. Welcome everybody, everybody who is here, that join us also every Thursday. And of course, all these webinars, we want for the sexual rights and reproductive rights of adolescents to become a reality. Thank you. Welcome again. Thank you, Dr. Calle, for your words. And now it's a pleasure for me to welcome and to give the floor to Dr. Alejandra Cuña Navarro. She is the Executive Secretary of the Council of Ministers of Health of Central America, to provide the official greeting. Good morning, everybody. It is also for me a big pleasure to be here with you this morning, and well, mainly with the young people also here, because they are the ones that are leading this activity, right? I also would like to thank the invitation, this joint work with Horas Conu.
Bueno, ese es el punto. Creo que estamos conscientes, ¿sí?
I think yeah, we need to ask everybody. Okay, so we can continue.
Okay, gracias, sí, porque yo escuchaba un ruido ahí.
So I was saying that the most important people here are the adolescents themselves. And so why am I saying this? Because we have been working with them, working in at Orasconu and also at Secomisca. We do have policy frameworks that have been established. We have policies and strategies that tell us about prevention of teen pregnancies. And we know that they are and we know that teen pregnancy is something that hinders their development, and especially it perpetuates poverty cycles, especially women coming from highly vulnerable populations. But that's why it is necessary to deal with comprehensive sexuality education, and that is a very important thing. And I think today's webinar is going to give us important elements to keep on working on this. So sexuality is an expression of the personality, and this is what Maria del Carmen already mentioned, and it's part of us as humans, and it has different expressions depending on the life cycles, but it definitely is most important during teen years, because that's where they start to identify the roles and need to explore and to know about sexuality and their own bodies, and to really have healthy personality and self-fulfilled personality that we hope all our adolescents in our region have, and mainly waiting for this to contribute to the quality of life of people and society. So I say that there are some important units that we need to mention. First of all, the family. It is the main proposer of this construct of a healthy sexuality. Parents are the first educators in terms of sexuality. And that's why there is a lot of myth and there's a lot of taboo, a lot of issues for parents to talk about that. And maybe it is not as easy for us if we don't know. And so I think there is an important element that it is important that we have to start looking at, okay, how are we going to work with the families? Then another important actor or stakeholder are the educators working in education for sexuality and affection, and to not only talk about biology, but also look at other elements that are part of these reproductive process, because I do believe that we have focused too much on biology. And when we see what the teens, it's mainly about the biological aspects and reproduction. But what about the rest of it? That's where we need to include the other aspects and knowledge, also social issues and values that imply to work on sexuality as a whole, and looking at affection and relationships. And I insist on this, sexuality is a process that goes through every single point of life. And then there's something else that I would like to mention also, and that there are some experiences, as Maria del Carmen said, and it's been shown already, that the main actor are peers, are the adolescents themselves. We have processes developed, and I can see here the population fund, and I see some other actions in the United States. But with the population fund, I think that in most countries we have been able to have capacity building in terms of comprehensive sexuality education and working with peers. And we're going to see that today. We're going to see this today with this adolescents that are going to talk about their needs. And only with this exchange that we can have with them, we can work as actors in health or educators in order to give them the tools so that they can talk between themselves. And then parents can talk about their experiences and knowledge, and they can do it, and the educators can do it too. But I think those who adolescents listen to are their peers, are the ones that are, they're the ones that are living there, and the ones that are in school like them. Or so I think this, for sexuality education has to be a permanent process throughout life, and this is what's going to help us develop. And that's why we feel so pleased to be in this process and to be working with Orasconu and participating in this event. So today we're going to listen to adolescents, we're going to listen to their voices, and I think that I would like to invite you now to tell us, what do you think we can do better? How can we help you? I know that you have what they requested, but if you see that, you can tell us something else, or you can help us understand what your needs are, then please let us know. I wish you all the success, and thank you, everyone from El Salvador. Thank you, Dr. Cunha, for your words. So after getting the greetings from the executive secretary, I would like to introduce myself. I'm Gloria Lagos. I am the manager of international cooperation and coordinator of the Adolescents Health Commission at Orasconu. And I'm going to be moderating this webinar along with Alejandra Rodriguez, technical assistance from Secomisca. And so I would like to now give the floor to Alejandra. Thank you very much, Gloria. Everybody, good morning. My name is Alejandra Rodriguez. I am the Technical Cooperation Assistant at the Executive Secretary of the Council of Ministers of Health, Secomisca. So without further ado, I would like to welcome Dr. Nelly Madrid Tejada, from El Salvador, a doctor with a PhD in medicine, master's degree on sexual and reproductive health, with postgraduate degrees on family violence and emergency crisis, perinatal health and maternal health. Dr. Madrid is a technical advisor for the Ministry of Health of El Salvador since 2008, and looking at maternal health in the integral maternal unit. She's currently the medical technical advisor, and she's also an advisor for issues dealing with maternal health, adolescents, teen pregnancies, and also in the different projects in Central America. So, Dr. Madrid, thank you very much for accepting our invitation. You have the floor. Thank you. Good morning, everybody. Thank you for the invitation. For me, it is a pleasure to be here sharing with us something that is so important, something that we believe is key. So, approach for the comprehensive sexuality education in the non-formal approach, in a non-formal arena. El Salvador has a population, according to the latest census, of over 6 million, population density of 301 inhabitants per square kilometer. We have a very young population. 51.4% are under 30 years old. And so we can see that those who are between 15 to 29 years old account for 26.6% of the population. This means that we have a total of 1,034,174 adolescents. That is 16.3%. So we are a very young country. Next, please. As we can see the population pyramid, you can see the arrow. That's what we have between 20 and 24. But like we said, 16.3 is mainly adolescents. What is our current situation as a country? We can see that we have 83% of all the cases that we get to the ERs are need with treatment. 38.4% is obesity and overweight, and there is no difference between the genders. We also have a very high load of urinary tract infections in girls and female adolescents, high burden of disorders of behavior, and the symptoms like headaches and gastritis, and all of these are handled as symptoms, and this usually happen to female adolescents. We also have in our registry that 13% of students report suicidal ideas and thoughts. We have a high mortality due to suicide and violence, and it mainly affects women. Now, seeing what we, talking about specifically reproductive and sexual health, we see that there is also a very early initiation of sexual life, 22% before 14 and 15% with a partner that is older in age, very low prevalence of the use of birth control methods. We also have a very high specific rate of childbearing, 74 births per 1,000 women that are between 15 and 19 years of age. High percentage of maternal care and deliveries. And we also see that in 2020, we had 9 pregnant women between 15 to 19 that had HIV. And in 2021, we had 12 pregnant women that were between 15 to 19 years of age that were HIV positive. As you can see, the source, this is all based on the Ministry of Health information, the survey in schools, and the multi-purpose survey. Next. So during 2022, the Ministry of Health reported 52,177 pregnancies nationwide, out of which is a high number, 10,355 are of girls and adolescents between 10 to 19 years of age. And this was a survey that we did in 2023, this month. And so for 2015, we saw that per every 1,000 adolescents, we had 37.5 pregnancies. So the rates were very high in 2016. We have been going down from 32.9, then to 29.5, then 27.7. In 2019, it was 25.2. So what we can see all of these numbers on the graph just to understand what it means. We see that in the blue bars, the total number of pregnant women. Out of these, then you can see the red bars are teen pregnancies, and they account for, as you can see in yellow, 31.7. So in 2013, we had 31.6%. So that means that out of 100 pregnancies, 31 were teens. And so we've been decreasing. There were very important milestones, as you can see, in 2017. And that year, we built and we developed the national strategy for the prevention of teen pregnancies, and it is valid from 2017 to 2027. And this strategy contains different ways of preventing and dealing with this, because definitely we know that this is intersectorial and multi-causal. And so back then we had 28% of pregnant teen pregnancies. We've been reducing this slowly, and then there's another important milestone was the COVID pandemic, of course, in 2020, where we started in 2020. And so we had a slight increase, then in 2021. But then also in 2022, we had this law come into force, the law called To Be Born with Love. And this is February 24th. This is when this law came into force last year. All of these, we know that is backed by the Ministry of Health, the main statement, which is to prevent with education. And this was an official statement of the Ministers of Health given in Mexico City on August 1st, 2008. They reasserted their commitment to enjoying at the highest level possible of health, education, non-discrimination, and well-being of the current and future generations. So here, when we talk about comprehensive sexuality education, specifically talking about El Salvador, we call it AEIS. That's the acronym. EIS, it is a process that is strictly related to the education of people, providing elements to clarify and to reflect on how to incorporate sexuality into life in a full and healthy way, in also thinking about human rights and gender equality. So what is the specific objective of these? To promote the exercise of sexual and reproductive rights of adolescents and teens through comprehensive sexuality education in formal and non-formal spaces of the country. I have to say that we do have 82% of school-age adolescents and 18% of adolescents that are not in school. And precisely this is what we have to deal with in the non-formal space. That's what we mean when we say non-formal. So all of these is influenced, and how do we create it? How did we create this model at the Ministry of Health? We dealt with it in different ways. This means that it is influenced by different issues, like legal issues, like affective issues, cultural, ethical, religious, intellectual, economic, social, psychological, and biological issues. All of these issues affect sexuality, and we know that all of these have an influence on sexuality of adolescents and of human beings in general. So if we talk about sexuality, talking about sexuality with adolescents, it is very difficult, but it is necessary to talk about this, because when we talk about myths and taboos, we realize that myths and taboos do not only exist in the population in general, but it can exist among health care providers. And that's why we always provide training and education to the health care providers and professionals. Sexuality means different things for people, and it means different things in different stages of their life. So to talk about sexuality with young people means to help them to understand the terms for their own sexuality. Next, please. So it's not only about behaviors, but also what it means for the people involved. It is important that we consider the social context where this sexual behavior occurs. It is important to keep an inclusive approach that means without discrimination. And it is also very important to deal with the sexual pleasure like issues like sexual violence or violence during dating. Next, please. As a country, El Salvador, at El Salvador, we do have a legal framework that is very good and that helps protect the rights of teens and boys and girls. We do also have part of the Constitution, we have international treaties like the Convention of the Rights of Children, the Convention for the Elimination of All Forms of Violence Against Women, the Protocol of Sedao. We also have the Convention against tortures and cruel treatment and so we have a series of conventions and treaties that are applied with the rank of law. And then we also have our law that came into force in January this year. And this is something that has been published. We can see that as a country, we have this legal framework and the support, and we are fully convinced of the importance of working together and working with the adolescents. And precisely, I will tell you what this model means. And so we have classified adolescents in four groups. The healthy adolescents, that's group one, or apparently healthy, because of course we also are based on the protection of the adolescents. We have group two, adolescents at risk of getting sick, adolescents that have a pathology, and then adolescents with disability. All of these, as you can see, this, of course, is based on providing support to all of these groups, and especially in the rural areas and the different health establishments, we divide them into basic, specialized, highly specialized, and hospitals. And so, as you can see here, we also have this classification of adolescents that are between 10 to 14, 15 to 19. And then we can see precisely that this is based and supported not only by the healthcare personnel, but also doing articulation with social participation, the social controllership, and the approach that we should provide for the other areas. What we just saw, and so talking about these different scenarios, we have the model of service of healthy life for adolescents. And so what we can see in the circles is the approach that we provide, and that is based on the gender approach, diversity, non-discrimination, and empowerment, humanization, the throughout life, community participation, and these two main areas, community participation, and this is where all of these the young people are included in these areas, and this is what we have in the healthcare establishments. We can see that there are different levels. One is the integral care for adolescents, and so here it's not only morbidity but also prevention, and this is what we precisely are interested in. We want to prevent, and we want to prevent in differentiated care, because definitely this is done by giving the confidentiality that they need, privacy, and to be treated in a humane way. And then another level, which is talking about general offices that are healthy, because even though they are differentiated, it means that anybody that is going to be dealing with the adolescents, it has to be done based on the rights that we just mentioned. Next. So as we can see here, this leaflet, these are all the services that we would like to provide to adolescents. Friendly services for adolescents, and we have them at the clinics or the different offices for adolescents. And we put an emphasis on all of these issues, all of these services that are requested by young people. So what are the health friendly services. These are areas where we provide the services that is adapted to their realities, to their needs, and that precisely we provide them with the approach, the human rights approach, confidentiality, inclusion, and so for adolescents to know firsthand what kinds of situations they could request information from or services. And definitely this is like STDs and STIs. And it's not only to seek for treatment, but we also are focusing on prevention a lot, because we do know that that definitely means preventing, but that is going to prevent many of the pathologies that we know that we may have at some point. We could have a high rate. And so we see that there is advocacy and visibility, and this is all part of what we do with the healthcare professionals. We try to foster and advocate for this not only at the local level, that is the primary care, but also at the hospital level. We have, well, I would like to thank, because I know that are many of you logged in today from the Intersectorial Alliance for Adolescents and Young People at El Salvador. We all play a prominent role in working with adolescents because we do have a lot of points in common. And so what is this work about? What is the objective? Well, to develop a series of strategies for the country, so that from a human rights approach and a gender approach will ensure the comprehensive approach of the health of adolescents and young people through the organization of the Intersectorial Alliance. So how do we do as this partnership and this alliance? We have different NGOs, interinstitutional organizations here represented, because we are doing a very articulated work here, and then implementing this and then for the 2021-2024 period. So here we do definitely, we have institutions like ISDEMU, the Special Office for Human Rights, or INTUBE, NGOs. It's also very important. It's many of them represented here, but just to mention a few, we have COMUDI, UFA, Plan International, PASMO. So, you know, there are many institutions and agencies and NGOs that are represented here and that are part of this alliance. And we have these approach that we know the adolescents need. And this is for the whole country. And like I said, based on this intersectorial plan of having consultation, elaboration, and implementation of the plans. As the Ministry of Health, we have technical guidelines for the integral and comprehensive care of adolescents. And then here we have all of these regulations that, as you know, healthcare professionals and those of us who are responsible of what we can provide as an institution, we can meet all of these guidelines. These technical guidelines, it's dealing with an integral care and comprehensive care. So right now, we are updating these guidelines, and we have not only for the Ministry of Health, but also for the National Comprehensive Health System. This document that you can see here, methodological guidelines for adolescents. This is one of the methodological strategies for adolescents, and this is the one that is used to be able to provide education to adolescents. So here we're talking about the methodological guidelines for adolescents. We have a series of very important issues, and this has been validated with different institutions and organizations, and also the participation of adolescents. This strategy replaces the one that we had before, which is the manual for the education and life of adolescents. So this is the one that we have in force right now. And we have had some training courses on how to use this methodological guideline. We also have these other documents. These are more consultation and reference guides, like the methodological guidelines of masculinities, the strategy on social art, methodological guidelines for adolescents in situation of migration. And then this one contains many points for this specific population who are migrants. Next, please. We also have these methodological guidelines for adolescents who are already mothers or who are pregnant. The methodological guidelines for mothers and fathers. This is to be used during these workshops where we strengthen the education for both fathers and mothers, could provide sexuality education in a comprehensive manner. And so that's why when we say for mothers and fathers, I think this is very good, and it strengthens and it improves communication, because sometimes that's something that parents fail. But this is a very complete guide, and it's always very useful at the local levels. Next, please. We're running out of time, so you need to. Okay, so additional accomplishments. We have professionals that are trained and they do replication with adolescents and families. These methodologies contribute to help the healthcare professionals. And then it makes for of course, having many accomplishments, and we've been able to assert that all of these institutions are very important. Challenges, and then I'll wrap up with this. As a country, we do have challenges to strengthen the role of protecting families. We also have to ensure that the responses of COVID-19 do not perpetuate nauseous gender norms and rules or discriminatory practices, to ensure a life free of sexual violence and non-discrimination, ensure that the policies and interventions around the response should respond to the needs of all the persons, boys, girls, and adolescents. It is important, and we are very clear, that another challenge is to maintain the educational path of girls and adolescents, to ensure access to comprehensive sexuality education, and to ensure the access to services that are friendly towards sexual and reproductive health and that will meet the needs of adolescents. So yes, definitely the challenges, as you can see, are big, are important, but I think we are on the right track. We believe we are on the right track because of all the accomplishments that we've had so far, and that we know that we need to continue doing. Thank you very much. Thank you, Dr. Nelly Madrid, who talked about the need of dealing with comprehensive sexuality education for the different groups and depending on the strategy.
de acuerdo al contexto social en el que se ubican, y nos presentaba los desafíos de país, entre los que nos mencionaba garantizar el acceso a servicios amigables de salud sexual y reproductiva que satisfagan la necesidad de los adolescentes. Estimada doctora Madrid, reiteramos nuestro agradecimiento.
Dr. Madrid, thank you very much for your presentation. And now we would like to invite you to stay here in case there is any question. So next we have the participation of psychologist Carmen Murguia. She is a clinical psychologist from Pontificia Universidad Católica of Peru.
Cuenta con una especialización en salud del adolescente por el Instituto Nacional de Higiene, Epidemiología y Microbiología de La Habana, Cuba. Una especialización en participación adolescente en salud y desarrollo por la Child to Child Trust de la Universidad de Londres, así como en intervenciones aplicadas a la salud con enfoque de desarrollo y derechos humanos. Obtuvo un diploma en prevención de VIH y SIDA por la Universidad de Brasilia. Fue presidenta de la Red SIDA Perú y tiene experiencia de más de 25 años en políticas y programas de adolescencia y juventud, salud sexual y reproductiva, derechos humanos y derechos sexuales y reproductivos, así como educación sexual integral. Se desempeña hace 15 años como analista de programa del Fondo de Población de las Naciones Unidas, Oficina de Perú, en temas de adolescencia y juventud, y más recientemente también en el área de normas sociales y de género. Estimada licenciada Murguía, muchas gracias por aceptar nuestra
invitación. Thank you very
invitación.
much for accepting our invitation, and you have the floor. Thank you, Alejandra. It is really a pleasure to be here on this webinar on sexual education. Please get the greetings from all the team of the United Nations Population Fund and our representative in Peru, Hugo Gonzalez. Also, thank you, Orasconu and Secomisca, for this invitation. And now I would like to tell you, I don't really have a presentation, but I am going to talk about directly the issue of myths and taboos around sexual education. I do believe that a first comment that I have for you is that these taboos and myths that exist persist. We did a publication a few years ago about 10 myths and realities of comprehensive sexual education. And we see that years go by and these myths are still there and we still need to work together to eradicate them. And a first myth that I would like to share with you, especially with young girls and boys and adolescents that are here listening, because I think that they are the main agents of change today. And we can definitely trust that they are going to completely change things, and they will make the sexuality education a reality in the Andean countries and Central American countries, because I think we all share the same challenge. So I think a first myth is related to the fact that sexual education at school interferes with the sexual education that is given at home, or that parents can provide. And I think Alejandra from El Salvador already talked about these very important role that parents play. And the reality is that there is no interference what the school can provide in terms of sexual education with what the parents provide. I think there is they complement each other. They complement, and that is very important. As was mentioned before, the parents play a prominent role and a privileged role because, of course, you know, the sexuality is it's born with us, and they are the ones that start teaching about sexuality. But the school also plays a very important role as part of quality education, so including comprehensive sexuality education with a rights approach and a gender approach and based on international standards is very important. And then it is also very important to take into account all of the data and the information. Like surveys that were conducted in Peru, 95% of parents and fathers or caretakers, they say that they do want for the school to provide sexual education to their kids. And 97% say that they should provide knowledge and skills to have a responsible and full sexuality. So I think there is enough evidence to be able to eradicate the myth, but we need to still keep on working and showing the evidence to overcome the myths. Now, a second myth, and it's very interesting, is that sexual education goes against the educational values. Some people, some movements say that it goes against values, and they say that because it is not principled, but it's completely the other way around, because we believe that what in comprehensive sexuality education implies is to prepare adolescents so that they are fuller, better, with the capacity to contribute to society and to have critical thinking. And so I think what it does is to complement this education and values. And so I think that is also very important, that we need to rebuke these myths and to eradicate these myths. And then something else that we need to consider, and that is very relevant, is that the code for boys, girls, and adolescents, which is a policy instrument, it says that the development of our personality should be included into the curriculum and to prepare boys, girls, and adolescents for life, giving them tools, competencies to have autonomous critical thinking and creative thinking. That is, we do have the backing of this policy document saying that sexuality education is actually integral part of education on values and education for a democratic coexistence and peaceful coexistence with non-violence. A third myth that is also very important to share with all of you, so that maybe we can have a discussion if you consider that this myth is still there, or if it is changing, or if we do still have challenges, is that sexual education stimulates the interest of adolescents in having sex at an early age. This is something that a lot of people think, and especially adults who are against comprehensive sexual education, saying that if you provide them with sexual education, what we're going to do is to have them initiate earlier, that the curiosity is going to, come early. And definitely this is not the case, because actually sexual education prepares them to get to know their bodies, to be able to take care of ourselves, to be able to say no if we feel that we are being touched in the wrong way, to say no when maybe our partner as an adolescent puts pressure on us to have sex and we're not ready and we don't want to do it. So I think that it is actually what integral education provides, and this has been shown with evidence, is to delay actually the beginning of sexual relations. So we do have hard evidence to go against this myth that relates sexuality education with promoting an early sexual initiation. So I think that this is also an important myth that is still there, and we still need to rebuke them with very solid hard evidence. Then there's another myth that is also very important that we talk about and share, and that the myth is that sexual education is only talking about sex, that is actual sexual activity. And that is, I think, the most false myth, because sexual education is more than just sex, more so than just talk about preventing pregnancies or preventing STDs, because what in comprehensive sexuality education seeks is to give skills and competencies to be independent and have an identity and to have a personality that will make ourselves feel good about ourselves and to be positive, to prevent violent relationships, and to be able to construct this social and gender norms that are discriminatory, that reinforce power relationships, etc. So I think that this is very important that we talk about this and to look for alignment and to talk about comprehensive sexuality education and decision-making, autonomy, independence, and to be able to really own our behaviors with the right skills and competencies in every field, including sexuality. That, as I repeat, I think that starts with us. And definitely that is very relevant, and we are prepared to start, but this starts with us at a very early age, since we're born. And so it's not only an issue related to sex.
Allí, por ejemplo, lo que dicen los datos es que en una encuesta realizada a estudiantes, 27% consideraba que la educación sexual le da elementos para valorarse mejor y conocerse a sí mismo, para desarrollar habilidades para la vida, para respetar más las relaciones entre hombres y mujeres, ¿no? Entonces va mucho más allá de solo el tema de la actividad sexual. Otro mito que circula
Another
también.
myth that is very common is that sexuality is something that is very intimate and private, and because that, nobody should meddle, and, they are minors, etc. However, while it is true that sexuality is part of our intimacy and privacy, it is also important to take into account that it's very present in TV, on social media, and advertising, and, daily conversations, and in the public and political agendas. So now it stopped being an intimate thing. And it definitely requires an approach that has different angles, and a strategy that will allow for people to understand, and to families, and to also looking at the role that the school plays in providing sexual education, and even with an intercultural approach, especially in countries that are pluricultural like ours. So definitely it is important that we can say that, okay, because it is intimate, we cannot talk about it. No, because that makes all of the, sexual abuse cases increase, violations, rapes, and trafficking, etc. And all of these are increasing, especially in girls under 15. And these are all related to sexual abuse, where girls really don't have the capacity to be able to say no, or to be able to get to know their bodies and to take care of them, and to resort to the right people to say that they are being molested or abused, or there are situations that are going against their rights. So sexual education has to do with this. Something else that is important to talk about education is to talk about sexual education is to talk about pleasure, and they say that, well, maybe if you talk about that, the kids will want to masturbate, or will start looking at sinful things like porn. But no, that's not the case. And of course, the content and the dimension of pleasure has to always be present in the education, because sexuality is not only reproduction. It definitely has an angle of affection and relations and diversity and identity, etc. So definitely it is a dimension of pleasure, but also self-care and caring for others. So definitely saying that it is only education for pleasure, it's not. It is an education to be responsible, and knowing that if I don't take care of myself, then I could be pregnant, and it implies to be a mother or a father at an early age, and what the responsibilities that these come along. And then to wrap up, because I want to respect the times that they told me, we have myth 8, and I wanted to share with you, is that, for instance, a lot of people say, well, it is not important to provide sexual education at school because it does not contribute to the performance, academic performance. So it's like they just believe that it doesn't really matter because it does not add to performance. But it is not the true. It is key for quality education, and it should be there, part of the curriculum. It has to be cross-sectional, cross-cutting to all the areas, and education, and it has to be a very important dimension, and it does contribute to the performance. And there are studies that prove that whenever there is when they implement programs to develop social skills, emotional skills, it has an influence on the better performance, academic performance. And then also the levels of criminality, consumption of alcohol, and other abuses go down.
efectivamente la educación sexual contribuye al desarrollo personal, pero también al desempeño escolar y al bienestar integral, ¿no? Porque también hay que pensar que no es solamente mi bienestar individual, sino el bienestar, el bien común, ¿no? El bienestar también de los otros que me rodean. Y si yo, mediante una educación sexual integral, enseño relaciones respetuosas, relaciones que no refuerzan los estereotipos de género, sino más bien los cuestionan y buscan cambiarlos, pues estoy construyendo también una sociedad que convive en condiciones de mejores, con democracia, con bienestar, ¿no? Y por último,
And
para
then lastly, just to share one more, is that, there are adults that say, for instance, well, nobody taught me about sexuality. I learned by myself and I'm doing good. So why do we need to include this at schools? Well, I would say that these people who never had the opportunity to get any sexuality education at school, and, they were doing good, quote unquote, well, maybe they were lucky, or they just did not, were not able to get to know in depth their bodies or be able to be autonomous, and they have been doing, trial and error. But that doesn't mean that we want the same thing for our children, for the new generations that can have access to a quality education, sexual education in a timely manner throughout their lives. Because I do believe also that we need to rebuke the myth that sexuality education only has to do with children and adolescents. I would say that sexuality education has to do with everyone throughout life. We need to continue educating ourselves. Society has to be educated on sexuality to be able to eradicate all of these myths that reinforce machismo and chauvinistic behaviors and violent behaviors, non-positive behaviors, and that we need to change so everyone can change. I would like to wrap up saying that we need to also eradicate that last myth, which is that we cannot do anything to improve sexual education in the country. I think that all of us, while it is true right now the education sector is maybe not implementing sexual education as we would like, although there are quite significant efforts, that doesn't mean that we are not going to try to do better, or that we are not going to have a try so that comprehensive sexuality education is a reality in our country, so that all the adolescents have the skills, necessary skills to live through a responsible, violent-free behavior. And then we also have, I think, a very important education outside of school, because it's not only at school. We also have strategies and we have some guidelines also that allow to implement and to promote this outside school. I think we have to look for different approaches and innovative approaches to advance, and using technologies and social media. Some very interesting things are being done, but I think the most important thing is to do more and better, so that this is, that the universal right is there for everyone, for all boys and girls and adolescents in our countries. Thank you very much. Thank you, Mrs. Murguia. So she was talking about different myths and taboos about sexual education that are still that still exist currently, and that definitely it is important to continue having the efforts to rebuke these myths, to prepare adolescents for life, giving them the necessary tools for their development, but they should be more related to responsibility, affection, and general well-being. Thank you, Mrs. Murguia, again for your presentation, and we would like to invite you to stay here in case there are any questions later. Well, very interesting, everything that we've heard so far. And before to continue with this activity, we would like to thank everyone who is connected from the Ministries of Health, from the academia, from different social organizations in Bolivia, Chile, Colombia, Ecuador, Peru, Venezuela, Costa Rica, El Salvador, Guatemala, Honduras, Nicaragua, Panama, Belize, Dominican Republic, Argentina, Brazil, Cuba, Spain, Mexico, and Paraguay. In the same way, we would like to greet very especially the following institutions that are connected and that have actually greeted us. The Ministries of Health from the Andean countries and Central American countries, the Ministry of Health at Honduras, Guatemala, the Ministry of Health of Nicaragua, the Ministries of Health of Bolivia, Chile, Colombia, Ecuador, Peru, Venezuela, the National Intersectorial Alliance of Young People at El Salvador, Ministry of Health of Peru, Universidad Nacional Mayor de San Marcos from Peru, the Impares organization, the medical establishment of the Peruvian Navy, the Villa Los Reyes of Ventanilla, Peru, GPK project in Cuba, National Institute of Health of Peru, CMF, Dr. Ignacio Chavez from ISSTE, and the technical teams at Secomisca in El Salvador and Horas Conu in Peru. So now we are going to continue with this important event, and we're going to give this space that we've been waiting for and hoping for very eagerly, and that is to start a dialogue with our young leaders. We have as guests today. I'm going to introduce Milen Ruiz, Peruvian, 16-year-old. She's a youth activist, and she belongs to a Futuro de Impares organization, and she works on comprehensive sexuality education. She is in charge of one of the areas within that organization. She's also participated in different roundtables and dialogue forum as a youth activist, representing the voice of adolescents. I would also like to introduce Masley Membreño, 15 years old. She she studies at Hermandad School in Nandasmo in Masaya in Nicaragua. She is part of the community network of Minister of Health as a health promoter. She's also a youth leader. Masley has been trained on different issues like prevention of pregnancies, family planning, and also creating a life plan. Her dream and aspiration is to become an excellent doctor, to be able to help her country and to continue supporting the adolescents at the Ministry of Health. And finally, we have Jose Daniel Nolasco, 18 years old, who currently is at the Damián Villacorta School in El Salvador. So welcome you all, and we will start our dialogue. I would like to request that you turn on your cameras. So this dialogue we have prepared based on 2 questions, but as was mentioned by Dr. Acuña, if you wish to add something else besides these 2 questions, you could do it, but in a very short and concrete way because of the time constraints. So you can continue sharing this. I would like to tell you that after this space, we also have the Q&A round for everyone because people are asking right now, and I'm pretty sure that they will ask you too. And finally, you will have a space, a 1-minute space for the presenters and as you to send the key final message. So having said this, we will start with the first question, and we are going to have the same order as I introduce you. Milen, and the Masley Jose, and then in the second question, it will be Masley Jose Milen. Okay, so first question, Milen Masley Jose. How do you think that comprehensive sexuality education contributes to your personal development and your sexual development? Milen? Good morning. I am very thankful for the opportunity you give me. And just like you said, comprehensive sexuality education goes beyond than just sex. Thinking that in terms of development, we can realize that it really helps us to have interpersonal relations in a better way. And that also can help us have healthier relationships. And it also helps in terms of our psychological and cognitive areas. And so what I'm trying to say is that sexuality education is not just sex, as was mentioned also by the doctor, but it goes beyond that. Now, in terms of sexual health, it really helps us to prevent undesired pregnancies and STDs and STIs. The rate in Peru, I think, is very high, but it's very centralist. And so we're trying to help also vulnerable populations in rural areas to really improve in other areas. But I can imagine that in Lima, if in Lima it is hard, I can imagine that it will be harder in other areas, because we do know that the teen pregnancies and the rate of teen pregnancies in other provinces of Peru is very high. And where we see that 14-year-old girls are pregnant already. And then we would like to start working on that. Thank you.
Gracias, Milena. Adelante.
Thank you, Milen Maesley. Well, greetings to you all. Thank you for being here, and thank you for inviting me to participate in this event. My answer to your question is, well, I think that sexuality is full of myths, and you know, they say that sexual education is just sex, and parents think that it is just sex, but I think it's not. I think it's not the case. It really helps us to know more about our sexuality. And I can give you an example. If you know, a girl tells her teacher that the uncle gives her cookies, and so she says, my uncle is giving me cookies, and she says that, and my uncle says that if I am a good girl with him, he will buy more cookies. But the mother doesn't understand what she's trying to say, because they never talked about this, that she could be in danger, because that was never an issue with her. And so I think that sexual education is very important. It's very important that parents talk about this from the very beginning, and especially with girls. Thank you very much. Thank you, Masley, for your participation. Jose, the floor is yours.
Tienes retorno. No sé si tienes algún aparato al lado que tenga micrófono también, José. Capaz.
You're having echo. I don't know if you have another mic open.
Principalmente considero que la educación sexual se debe tratar como un conjunto. ¿Qué quiero decir con esto? Que sea la educación en la familia, la educación en la escuela y en la comunidad. Los jóvenes a veces quizás tenemos el miedo de llegar a las instituciones de salud a pedir información.
Well, the audio is not good, and it's very difficult to understand, to interpret.
Un joven de 13 años tiene la oportunidad de quizás tener relaciones sexuales, pero quizás no sabe lo que debe hacer. Solo tiene éxito por tanta información que tiene, pero no la información adecuada que le debería llegar.
José, ¿podrías bajarle el volumen a la computadora que tienes al lado? Me están indicando eso porque parece ser que que continúan escuchándote con distorsión. Si bajas el volumen a la otra computadora, creo que podríamos hacer la prueba. Adelante, por favor.
Perfecto. No sé si... Sí. Ahora se escucha mejor. Sí, no tengo otro dispositivo a la par, no sé por qué sería.
Sí, no sé si te alejas un poquito.
Ok. Sí,
A
pues
ver.
Por eso considero yo que sería lo importante. Esa educación integral sexual nos ayuda mucho a tener mejor conocimiento de nosotros, digamos, evitamos embarazos con las niñas de 13 años. Siento que en El Salvador ese punto nos hace mucha falta. La intención de querer ayudar a los jóvenes, pero no tener reconocimiento. Por eso sería importante que como jóvenes nos doten de conocimiento para nosotros poder guiarlo a los demás. Gracias.
Muchas gracias, José.
Well, thank you, Jose, for your answer. So now I'm going to move on to the second question. What do you think the children and adolescents need so that a undesired pregnancy can be prevented? Masley, you have the floor. Well, first of all, I think that communication within the family is key. You know, how the trust, because if there is no confidence, no trust and no communication, then definitely at some point, this, you know, the kids will not talk to their parents about what's happening with their in their personal life. So I think there has to be, you know, harmonious life, open sexual education. I think, like I said, this is very important because then parents will understand. They will start talking to their children without being ashamed or without feeling that this is not right. That they need to start talking about people that abuse and that they have to take care of themselves or saying no. And that especially for, you know, preventing abuses and to talk about sexual violence and what it is about. And I think it was in 2006 when they started doing this in Nicaragua, when Rosario Murguia started doing these encounters in schools to talk about sexual education. So right now there are counseling and parent school to talk about this. So from the primary school and then secondary school, they give counseling and advisory about these topics. And I think that is very important. And also talking about the rights of women and dignity of women for the prevention of sexual abuse. Thank you very much. So now we're going to give the floor to Milen. So I have to say a phrase that I like a lot, which is maternity will be wanted or not. So what do I mean? I mean that the support that we need are mainly two: trust that people need to trust us and what we do and what we are, and the work that we do, activists, organizations, institutions. And we also need comprehensive sexuality education. Here in Peru, this kind of sexual education is very I don't have a word really to describe it, but it's not good. It's not good. I am an adolescent. I am still in school, in high school, and you know, I've had to look for information myself because at school I don't get it, and it's really not good because, you know, not everybody has the same opportunities that I have, because sometimes online you don't find the information that you want or in the way that you want it, or you find wrong information, and that is very bad for you. So what I'm trying to say is that in order to prevent teen pregnancies or undesired pregnancies, we need trust. We need trust by our parents and teachers and the school system and the state, so that we can fight against this. Because like I said, and again, and I said it before, you know, we see that the teen pregnancy rates are very high, especially here in the jungle of Peru. It's very high. We don't want this rate to keep on going up. And they start at a very young age. It is not possible that a, you know, 12-year-old to give birth to another baby. She's not ready psychologically, physically, or economically, and they won't be able to give the good life that this baby deserves. Thank you. Thank you, Milen. Jose? Well, first, I think it is important to talk about the whole, because again, it's having an articulation between different, government entities, the health systems, education system, and the families. So there has to be an articulation of all, so that all together they can get together and say, okay, let's get better, let's get more education, more information, and prepare our children for this. Because sometimes, the young people, they just do it, and they don't know sometimes how to be in a relationship or how to have sexual relationships. Maybe because the parents sometimes don't or do not trust us, and they don't ask us, okay, what are you doing? Are you having sex with your girlfriend? Or maybe a teacher, maybe we trust the teachers a little bit more, but maybe a teacher, they also have myths and taboos, and they have a more outdated thinking about sex. They get nervous and they don't know what to answer. And then, so what do? You go, you talk to your friends, and your friends are the same age. What information can they give that I don't have? So that's why I think it is ideal that as a Ministry of Education and Ministry of Health together, and help the families and help the teachers to have better information, fuller information, so that all of these teen pregnancies are prevented. And not only pregnancies, but also STDs, STIs that are a big problem that happen very often. And I think that's basically it, to help and to articulate, to have this coordination between the health sector, education sector, and families. Thank you. I would like to ask you if you would like to add something else. Masley? Well, I just want to say that the Ministry of Health and the Ministry of Education, they do sometimes work together, and they talk about prevention of pregnancies and prevention of abuse. And so I think we can have better. Personally, I also get these lectures from the Ministry of Health, and I share them with my friends and in my community also. Thank you. Thank you, Masley Milen. Well, I don't know if you agree with me, but because of what I've lived, so once I tried to go to a health center to ask for birth control method, and they treated me very wrong. They said, no, we cannot give you this, and they don't know how to deal with us. And that's something that, it complicate things, because it's our right. We can have access, we should have access to birth control, but the state, the government is not really providing the information, or they don't really educate or train, or the teachers and the Ministry of Education is very lag behind as well. Or, doctors or nurses, there's still a lot of taboo. There's very few entities that really have this openness, that have an open mind to talk about this and to give us the information. But I think this is a struggle that we need to keep on, fighting, so that we can really improve situation, not only improve, but everywhere else. Thank you, Milen. Jose. So yes, maybe just to say that to have sometimes healthcare and entities, sometimes they have a 13 or a 14-year-old coming to the health center asking for birth control methods or preservative or condoms, and then the people at the healthcare center, they look at them and say, why are you asking for this? So instead of giving information and trying to improve the information, they just say no. And so I feel that that's one key thing that we still need, and that needs to be improved in Latin America, and well, specifically in El Salvador, talking about myself. Thank you very much. And yes, definitely this, these things are very important. It's been quite enriching. And, what has been mentioned throughout this webinar First is to know that sexuality education, comprehensive sexuality education, is something that is, is given from the day you are born. It's not that you're going to have certain time of the life to sit down and talk to them. From the very moment that they, a girl is born, and then you put on a pink shirt, or you buy the ball for the boy or the doll for the girl, from all of those. But then when and then you say, this is a mouth, this is nose, this is foot. But then when you talk about the genitals, you give it 50 different weird names. So why is this, does this have this, hiding and changing the names? That is already sexual education, and we already need to know this. And just as we grow, when we find, for instance, a boy and a girl playing, and one is on top of the other, and then we get we put the malice in there because that's what we believe, and they don't think about that. But when we are treating it, we're saying, what are you doing? What are you, one on top of the other? What is this? That is already sexual education, and it is distorted. And there's so many examples of that. And so on top of this, we have the importance of understanding that sexual education is something that is given in every stage of our lives, and that we all have the obligation of reading and being informed and listening to learn, because we're all, and I am going to talk about parents and teachers here, and also the healthcare professionals that Jose mentioned and Milen mentioned. When they went to a healthcare center, they were not lucky enough to run into responsive people, and because we're all a result of our educations. And sometimes it is very hard to work on that if you don't really understand that you have, that there is sexual education happening everywhere and all around us. And if you don't know your prejudices, then you won't be able to change them. So I think we do have the obligation of changing, getting better, getting ready. And that's why we have this responsibility, and it's all of us to know exactly what we do. And that in our houses, in our families, with our friends, let's talk about the genitals as genitals. Don't change the names. Let's do it respectfully. And not everything is sex. It's not only talking about, okay, are you going to have kids or not? It's not only about STDs. And I think it's more than that. I think if we are all going to talk and be open about this, I think we're going to slowly be better and have a better sexual education. And I fully agree with the three of you that sexual education has to be intersectorial. It's not just the responsibility of one doctor or one nurse or one obstetrician. It's not the responsibility of one teacher or just the parents. I think it's a responsibility of all of us, and we all have to work together, and we all have to support each other so that we can create the changes that we want in ourselves, but not only for us, but also for those of us who come behind us. Now, I think this is what we need to try to look for. So now we're going to continue thanking you very especially for being here. Thank you for your participation, Miley, Masley, and Jose, and then also our presenters. Thank you. And so now we're going to ask you to turn on your cameras because we're going to start the Q&A round. We have gotten some questions from the public.
Doctora Nelly Madrid, en este momento te paso las otras. Adelante, por favor.
Muchas gracias, Gloria.
Thank you, Gloria. So as Gloria said, we have a few questions that have arrived here for Dr. Nelly. I don't know if Dr. Nelly, I don't know if you want me to read them all or we go one by one. No, let's go one by one, please. Are there factors that can contribute to the under registry of teen pregnancies in El Salvador? Well, no, not really. Everything, we have a registry that is very efficient. So no, I don't think so, because even at the community level, we have our social workers, and once they detect someone, they send them to the healthcare center. And then, of course, so definitely there is a very good registration rate. Then the next question is, what is the importance of having accurate data about this variable? We're talking about the registration. What is the importance of registering teen pregnancies? Well, it is very important, because we do know, and I'm going to give an example with scientifically proven data, and this is something that was done in 2020. This data is used to focus the efforts even more. So we know that as a country, we do have an increase, but there are some regions and municipalities that do have a higher rate. So definitely this information helps us to focus our efforts. And in fact, and that's why I was telling you about the work that I do here, we provide support and accompaniment and both to the Ministry of Health and other institutions and entities that are related to really face the challenges that we have. Because definitely, though, my country is small, but there are big differences between one department to the other. But definitely, as a Ministry of Health, we do have guidelines for the whole country. And so it is our duty, definitely. But definitely, it is also very useful for this kind of strategies. Thank you. The next question says, based on the scientific evidence, what are the communication strategies that could be efficient to promote and increase the level of access to the healthcare services that are aimed at adolescents? Well, definitely we do have several strategies. One of them, or campaigns we have with the different media, and we have promoting that we do have the differentiated services. But I think what works the most, and we do have it with a lot of scientific evidence and hard data to prove it, is education with peers. So when one adolescent talks to another, and when one adolescent informs and communicates, I think it's better. And we know that we are not all at the same rhythm, but we are very clear. And when the adolescent talks to another one and says, well, here, this is a good healthcare establishment because they talk about this. And I think this is good, because also they respect privacy and confidentiality. And this is work, the peer-to-peer and approach. And then something else is working with the healthcare promoters. And then also, like I said, the campaigns, social media campaigns, that also helps us a lot. But I think it's mostly the peer-to-peer approach. That's one of the strategies that works the most. Thank you. Is there any other question? Well, if I went too fast, you can ask me again. No, there's no other question. If you would like to say something, you have time. No, I just wanted to say that, about promotion and advocacy. This is something we're doing along with the Intersectorial Alliance for Adolescents and Youth, because in the case of adolescents, we know that social media is one of the most important ways of communicating for them. And so this has been very helpful working with other adolescents. Like we see here, we have 3 adolescents here, and they can share with their peers, and they have these and so when we're talking about
mucho más amplio. Cuando hablamos del tema de prevención de la violencia sexual como tal, cuando hablamos del tema de autoestima, todo esto nos ayuda para que
And all of these helps us so that other people can then communicate to other peers, and then ultimately they can get to the local levels. Because we do have multidisciplinary teams so that we can not only think about treatments, but also prevention. We need to think about that. We need to think about having different approaches. We're talking about a multidisciplinary teams because we don't only want to have a doctor or a nurse. And I think that's one of the strengths that we have here. Thank you, Dr. Madrid. Now we're going to move on to the questions for addressed for Dr. Murguia. It says, in Peru, there were quite important progresses about sexual education. However, these have been attacked by the politicians. Well, thank you for this question. It's so important what to do with that. Well, in terms of sexual education, really, not only in Peru, I think in general, in Latin American countries, including Central America, there's ups and downs, right? And it's really the ups and downs depend on the incumbent authorities and the different sectors that at some point are leading these areas. However, I do believe it is very important to have to take into account that there's no excuse for not having quality sexual education. We have international standards. We have evidence that in a comprehensive sexual education combined with services that are differentiated and friendly with safe environments and opportunities for adolescents, they can reduce the rate of teen pregnancies and prevent them. And so now they are also doing studies to look at the, difficult or vulnerable situations. So definitely there's evidence, there's guidelines, there's standards, we have materials, guidelines. I think we have them enough. And a lot of countries have developed protocols and guidelines and educational materials for parents and for adolescents and teachers. But what's lacking is really to having a mainstreaming of this sexual education in the curriculum. And of course, Peru has made progress in terms of including this into the national curriculum. We do have guidelines recently approved for comprehensive sexual education, but all of that is just that letter. It's just on paper. If we don't really implement this in, day out in the classrooms, and for the boys and girls that really require this kind of education. So I would say that we need to keep on advocating from all the different spaces, Horas Conus, Secomisca, so that they can make this a reality. And at the same time, to have advocacy and so that we don't take steps backwards, but that there is a step forward. I think it's very complex. This is very complex because we do have approximately 50,000, 60,000 public schools in Peru and over 300,000 teachers. So how to get to all of them, how to train them all so that they all have the tools so that they can really provide quality education. It's very challenging, but it's not impossible. I think we do have examples like Uruguay that, while it is a very small country as compared to Peru, they've been able to incorporate this and to implement comprehensive sexuality education in a very good way for primary school, high school. We also have examples in Argentina, Brazil, but also in many other countries when, there were stages where they were very good and then there's, steps behind depending on the incumbent authorities. But I think that we should have this as a state policy. It should not change depending on who is in charge or who is leading, right? Because the administration changes, they should not change. And so I think that would be my comment. Maybe it's not an answer, but I think it's certain, windows of opportunities to keep on having an influence. Thank you. We have a second question. What are the best strategies to involve the adolescents even more in a more effective way?
Ya, o sea, de repente sí, involucrarlos
So maybe to get them involved, as I said, into all of these advocacy processes, but also within their schools. So I was thinking, these youth councils that they start advocating for sexual education to be part of the basic education at their schools. That is that the adolescents and young people, they should actually make this part of the agenda, the user social media. And in fact, there's very interesting experiences like Sin Tabúes, I don't know, without taboos. They are doing sex education on social media. There's organizations that have done very interesting work in San Juan de Lurigancho, San Juan de Miraflores. And then all of this is very important because it adds up, I think. So definitely, how can we get the young people involved? I think by putting sexual education as part of their own interests, so that they can be better persons, to be better professionals and better citizens. Because maybe now we have young people, especially in the post-pandemic, they're more interested in, finishing their school, getting a job. But all of these, this part, this, the education or a job, it cannot happen efficiently if there is no other component. And that maybe unpredictable events that are related to have all of these, the dreams that I have of being someone, because maybe I have because maybe I am a victim of violence, etc. So definitely sexuality is very related to a full life of a person and the development of the personality. And so if we sell this idea to more kids, I think we can have a big movement so that comprehensive sexual education can be given outside and inside the schools to be able to really get what we want. Thank you very much. We also have questions for the adolescents that are joining us. So if you want, you can raise your hand and we will give you the floor. First question is, how do ministries of health and education can improve their scope and outreach to improve sexual and reproductive rights? I think that just thinking about well-being and common well-being, because we know that that is going to be better to help us grow as a country and to trust on, any progress that we make. I think that would be the most important thing. Thank you. I don't know if anybody else?
Es José quien
José.
la máquina de Ricardo.
Oh, Jose, yes. So, yes, again, integrating all of the sectors. I think that's the most important part, to have better sexual education. Because if we have an articulation between the different sectors, younger population will be more informed, will know more things. And when people, when they know more, they can trust other people. And we will share this information with other sectors. And I think this is important. Thank you, Jose. And Masley, I don't know if you want to say something else. I think that I support what everybody has said, but also having follow-up and integration, mainly, as they mentioned, articulation and coordination between the different sectors is important. And then the last question is, what do you think are the best mechanisms to keep the population informed about the legal aspects that would support or hinder sexual education in your country? Can you please read the question again? What do you think are the best mechanisms to keep the adolescent population informed about the legal aspects that either support or hinder progress in comprehensive sexual education in your country? I think that the best thing that can be done is, like Dr. Carmen said, is there are many, many organizations like Sin Tabúes or other organizations that are working on this. And they always talk about any laws that are passed. There are many laws that are being passed since up until last year. And so now they share this content with us, and the content is very interactive. It's not boring, because if you put something in, boring to a teenager, they're not going to be interested in this. And so social media is important for us. And then also at schools, they need to be clear, not to lie, because in the end, they're working for everyone. Thank you. I don't know if Jose would like to say something, or Masley.
En mi punto de vista sería comenzar desde pequeño, desde la familia, digamos, los padres en el momento de cuando el hijo va a kinder.
So we know that from the very moment the kid goes to school, they say, as was mentioned before, they start giving different names to their reproductive organs, and then you start getting idea that this is how it's called. And then I think this is what distorts information. I think it would be good that information would get to the different the schools, because it's mainly where most of the young people are, and to have activities that are creative also, because as was mentioned recently, if you present something boring, they're not really going to be interested. So maybe just thinking about having activities. And in November at El Salvador, there was a trip to a volcano here in this area, and it was very, very fun and very informative, and it was very nice, because we had also people from other parts of the country, from San Miguel, San Salvador, Santa Ana. These are all departments and provinces from El Salvador. And we had brainstorming to talk about sexual education, and it was really good. So maybe you can do this kind of activities and trips, and these are very, it's fun, it's informative, we learn, and I think that you can share the information with us in that way. Thank you. So communication between peers, I think, is important, and it would be advisory, and to have different institutions talking together, talking and having and talking openly to the adolescents about their bodies, as we heard from Jose too. Then to that parents, since they're very little, they should give the proper names to things. Then also having fun activities that are not boring, but also that these activities can have information that is important for them. Thank you everyone for answering the questions, and thank you also for people who asked the questions. And well, unfortunately, we don't have the time to answer them all, but we will actually take them into account to then define the topics of the future webinars. Thank you for your interest and participation in this webinar. To wrap up this Q&A round, we would like for you to give a final message, quick message. Well, we adolescents are interested on sexual education, and we do want a comprehensive sexual education. And I would like to talk about all of us. I work with them every week. There's in many places of Peru, because we do believe that sexual education can help us have a better life and a more adequate life. Thank you. So maybe just to again say that we need more information. We need more information about sexual education so that we can also share and be better. We're very interested on this, but sometimes we don't have the tools or the information that we need to then share it to our peers. As was mentioned today, it's not only about sex. It's not just sex. When we talk about sexual education, it's more than that. And so definitely the information should be shared, and you should talk about all the other angles of sexual education so that we can then share it with our friends, and then there's a chain until we get to a lot more people. I just want to say that I also will inform my friends and peers, and I give talks. And so sometimes they ask something, and if I don't know the answer, I have to go to the Ministry of Health or to the healthcare establishment to get the information. But I think that we need to have this openness, and that again, sexual education is not just sex, but it's just getting to know ourselves, our bodies, our minds, and each part of us. Thank you. And then Dr. Madrid or Ms. Murguia, you also have a couple minutes for your last key message. Well, I just want to thank, I think it's very relevant. And in a way, I think we are used to having a sexual education to be very low key profile, right? But I think we need to be more open about it and talking about it, having this forum, this, having different spaces, dialogue spaces at Horas Conu, Secomisca. I think this is a very important tool for the development of all people. And we should not stop until it becomes a reality, until this is a reality both inside as well as outside school. You definitely have our support from the United Nations Population Fund. We have the commitment. And so whatever you need, we have tools, we have knowledge, and the support to keep on moving forward. Thank you. Well, thank you. Thank you very much to each one of you for your time. Thank you for the lessons that gave us their comments. It really encourages us to see them, and it's so refreshing to see that they are part of these and that you have such strong ideas about this. And in terms of not only, formal, but also non-formal spaces. And also thinking about strengthening what is being done at school. So thank you very much. And we will be in touch. We will keep on being in touch in this spaces like this and in any others that will open. So thank you very much to each one of you. Okay, again, thank you to the presenters, to the youth leaders that joined us today. Thank you. Your contribution is very valuable. And then you will be able to have access to this webinar on the website because you will have access to this anytime you want. We also want to thank everyone who's been here today, the technical teams at Horas Conu and Secomisca, everyone who participated in this activity, the attendees, and this was possible thanks to the commitment of Andean integration and Central American integration. Thank you very much. So I would like to give the floor to Maria del Carmen Calle to close this webinar on behalf of the Andean Health Organization. Well, you know that my weakness is the adolescents. I am a pediatrician, but I always worked with adolescents. And when I listen to them, I remember, I don't know, I think I lost count of this when I used to train and educate on sexual education. I'm talking about 35, 40 years ago. I've been trying to count the years, but I completely lost count. We cannot really say that we have not progressed. Really, I think we have made progress. Maybe not as much as we would have liked, but I think we have made progress. We do know that to preventing pregnancies, which is one of the main concerns, we have three major pillars. First is having quality education. And as part of this quality education, we need the comprehensive sexuality education from the very first years of life. Secondly, we need services that are accessible, affordable, user-friendly, and with modern birth control methods for those who already initiated their sex life. And third, we need opportunities for adolescents and for young people. Because if we don't really have all of these three things, definitely we won't decrease teen pregnancies. We have a greater use of birth control methods. Yes, there's more use of implants, and there's been a slight decrease of pregnancies between 15 and to 19. The bad news is that there is a very important percentage of parents of kids and fathers of and mothers of kids that are over 14 that are teenagers themselves. So what is this saying? Everything that has been mentioned here, that there is no information at the hands of everyone, that definitely the schools are not implementing sexual education in the right way, that services did not necessarily give a good service to the teenagers whenever they are looking for information. Or but it also says that we still have not been able to understand what really is sexual education is. What we do know is that we know what we're talking about here, but then everybody else, and I am not talking about we have over 500 people connected today. We have right now over 500 people logged into this webinar, and I think we can, and probably so, we have 20 countries that are communicating right now. And this means that definitely we are learning a little bit more, because this is, continuous learning. But we need to start from the beginning. What is sexual education? What does it mean? What does it include? And that's why the experts and the adolescents that have spoken today are very clear that this is not just a matter of sex. It's a matter of learning to develop as a person. We're talking about puberty and changes and independence. It's a matter of talking about relations and how they are related to their parents, to their friends. And it's an issue of gender identity and sexual orientation. It's so much more than just sex. It's talking about STDs, preventing teen pregnancies, abortion, violence, but it's also an issue of values. It's also an issue of providing skills and competencies so that we can meet, when we can exercise sexuality. And when we're talking about sexuality, of course, what Camille just said, the issue is also talking about pleasure. It's not, you don't only have relationships to have kids, of course, so you need to have a healthy sex life. there's a lot of evidence now, a lot of evidence. And here I would like to say this very nicely. Those of us who are here, we are here as, healthcare professionals. We are leaders. And in other words, what we say, it does matter. It does matter. And so definitely, let's just use the evidence. We have a lot of evidence. And Camincha has talked about the myths, and there is evidence to rebuke all of these myths in a, very, very stark way. There is a lot of evidence saying that comprehensive sexual education doesn't make the kids to have more we are professionals and need to be based on evidence, but also we are full of laws and rules and regulations, and there's protocols everywhere. Nelly has shared with us from El Salvador, but we all have guides and protocols and everything.
Yo soy joven, ¿no? No soy joven ya, pero soy joven porque siempre me he rodeado de jóvenes. A los pediatras nos dicen, mientras te rodees de chicos y jóvenes, te mantendrás joven. Así que yo siempre hago eso. Pero a los adolescentes y jóvenes, ¿qué les toca? Velar, pues, porque se cumpla. Eso es lo que les toca. Nosotros creemos mucho en la solidaridad. Que yo tenga las posibilidades, creo que Mailén o si, no me acuerdo quién lo dijo, pero la cosa es no solamente que tú tengas el conocimiento, sino, creo que también lo dijo Joven, no solamente es tu conocimiento, sino tú tienes que ser solidario con los que todavía no tienen el conocimiento. Pero no es suficiente el conocimiento, por favor. Este es un tema de actitud, este es un tema de derechos. La educación sexual es un derecho. No es que, ay, qué buena gente que son conmigo, me van a hablar de educación sexual. No, no, no. Este es un derecho que tienen todos ustedes. Es un derecho. Y yo creo que por eso ahora Cono y Secomisca está en estos foros, porque nuestros pilares principales son el cumplimiento y la implementación del derecho al mayor nivel de salud. Pero cuando hablamos del mayor nivel de salud, no podemos dejar de lado todos los derechos humanos. Y la otra parte es tratar por todos los medios de disminuir las desigualdades. No es posible que yo sí pueda tener toda esta capacitación, como dice Mailén, ¿no? Porque a mí me enseñan, porque yo capacito, y como dice Saya, lo mismo, ¿no? Yo puedo, yo doy. No. Lo que nosotros tenemos que lograr es que esas desigualdades no existan. ¿Qué significa eso? Todos tenemos derecho a la educación sexual. Todos y todas. Y un tema muy importante que yo creo que debemos manejar siempre es el tema del respeto a la diversidad. El tema de la inclusión, el tema de la equidad, que no solamente sea un lema, ¿no? Ahora esa moda, ¿no? Diversidad, equidad e inclusión. Todo el mundo lo dice, pero a la hora, ¿cómo se traduce? En algún momento lo dijo Camincha, ¿cómo operativizamos todo esto? ¿No? Y un tema que lo han repetido, lo he captado como 6 veces, la confianza. La confianza en nosotros los adolescentes. Lo han repetido como 6 veces. ¿Ah? Ustedes saben que las que manejamos este tipo de cosas, vamos escuchando qué es lo que se repite varias veces, porque eso quiere decir que es algo importante. Pero ¿cómo vamos a recuperar la confianza? Cuando tengamos una mejor comunicación con los padres. Y ahí sí yo creo que nuestros padres necesitan mayor apoyo. Nuestros padres necesitan mayor apoyo para que puedan comunicarse, para que puedan decir, la verdad, hasta aquí sé yo, más ya no sé. ¿No? ¿Qué tal si hablan con los chicos con ustedes, ellos saben más que yo, hasta aquí puedo darte, pero la comunicación no es fácil. Los estudios son clarísimos. Hay un mundo de diferencia entre las generaciones. La generación de los padres de chicos de 15 a 20 años o de 10 a 15 están en otra, ¿no? En otra sintonía. Hay cosas muy importantes y esto de la educación sexual en muy pocos todavía está tomando un sitio prioritario. Bueno, pues si no es así, hay que ayudarlos a que sí se haga. Yo soy pediatra. ¿Cuántos papás y mamás me han preguntado, y doctora, ¿desde cuándo le comenzamos a hablar? Y yo creo que Gloria dijo una cosa que es muy cierta. Nuestro ejemplo, lo que hagamos nosotros, también tiene que ver con educación sexual integral. Cómo se tratan, ¿no? Cómo, no solamente ponerle los nombres, sino cómo se establecen las relaciones. Y por ahí también lo dijeron, estas relaciones inequitativas, con tanto machismo que hay en nuestros países. Así que nos falta un montón por hacer todavía, les cuento, nos falta un montón. Yo creo que ya tenemos los marcos normativos, yo creo que ya las organizaciones digamos, apoyamos, reconocemos a UNFPA, que siempre nos ha apoyado en este sentido, SECOMISCA, Horas CONU, siempre también estamos poniendo definitivamente los derechos de niñas, niños y adolescentes como una de las líneas estratégicas prioritarias. Y solo quiero cerrar diciendo, niñas, niños y adolescentes no son el futuro, son el presente. De todas las intervenciones adecuadas que hagamos, va a depender su futuro, el futuro de las comunidades y el futuro de nuestros países. Y la educación sexual integral es un pilar importantísimo para el desarrollo. Muchísimas gracias por haber estado con nosotros. Este ha sido el webinar número 159. Agradezco a todos nuestros magníficos ponentes y los invitamos el próximo jueves a las 11 a nuestro webinar número 160. ¿De qué vamos a hablar? Avances y desafíos en la lucha contra el cáncer infantil en los países andinos. Muchísimas gracias, Gloria. Muchísimas gracias a todo el equipo de SECOMISCA. Muchísimas gracias, Alejandra, a todo el equipo de SECOMISCA, a todo el equipo de Horas CONU. Y bueno, seguiremos trabajando, pero yéndonos claramente con el mensaje que la educación sexual integral es un derecho para todos y todas, sin excepción. Buenas tardes, pásenla bien, nos vemos pronto. Gracias.
Buenas tardes. Gracias. Abrazos, saludos.